there are also healthy levels of anxiety. It can keep us on our toes, it can keep us alert, and it can be very helpful sometimes. However, what I have found the differentiation there is when someone has been experiencing constant symptoms and excessive worry, which is one of the cornerstones for generalized anxiety disorder, it needs to be lasting at least 6 months or more. And if someone's coming to me saying, I've tried this, I've tried that, I am excessively worrying about XYZ on a daily basis for 6 months, that's when they're going to be meeting more of a criteria for generalized anxiety or panic disorder, OCD. So the timing is very important. And like you said, it's important to normalize anxiety too. We all have it. I have it sometimes. It's completely normal. And we need to validate that for people so they're not overthinking, oh, I'm sick, something's wrong with me. Because most times it's just situations or circumstances. So that timing, that 6-month timing, I think is very important for people to know.
So I just want to preface with anxiety is normal, right? Like we all experience it, and there's normal daily anxiety that every person goes through, and it's very vital for us to experience anxiety, right? Like it serves a function for us. And I think some of the normal day-to-day things, right? There's a very clear trigger. Like, for example, if, we're starting a new job or it's a first day of school tomorrow, or maybe we're going on a first date, right? Like it's natural and normal for us to feel kind of anxious, a little uneasy and worry about that. And that anxiety is something that everyone experiences pretty much across the board.
Okay.
And so I wanted to differentiate normal and common anxiety from anxiety disorders for people.
Sure. And most people, honestly, and generally speaking, don't meet criteria for a lot of anxiety disorders. Usually it's an adjustment disorder if there's a situation or circumstance. And there are also healthy levels of anxiety. It can keep us on our toes, it can keep us alert, and it can be very helpful sometimes. However, what I have found the differentiation there is when someone has been experiencing constant symptoms and excessive worry, which is one of the cornerstones for generalized anxiety disorder, it needs to be lasting at least 6 months or more. And if someone's coming to me saying, I've tried this, I've tried that, I am excessively worrying about XYZ on a daily basis for 6 months, that's when they're going to be meeting more of a criteria for generalized anxiety or panic disorder, OCD. So the timing is very important. And like you said, it's important to normalize anxiety too. We all have it. I have it sometimes. It's completely normal. And we need to validate that for people so they're not overthinking, oh, I'm sick, something's wrong with me. Because most times it's just situations or circumstances. So that timing, that 6-month timing, I think is very important for people to know.
Absolutely. And I think a big piece of it as well is that typically when there's like a normal level of anxiety or just like the general kind that people experience all the time is that when the trigger or when the situation is done, that level of stress, it leaves, right? Like it's no longer present, it subsides. Versus generalized anxiety disorder or panic or maybe OCD, that stays with us, for, like you said, an excessive amount of time. And there's almost an irrational or an over-exaggeration of the experience internally in proportion to the actual situation, right? So we want to be able to kind of compare, and what a reasonable or proportionate amount may look very different for a lot of people. But I think you're saying the time frame, and also if it doesn't go away or if it doesn't lessen as the situation leaves, then that's a pretty big trigger for us to recognize, like, okay, there's something deeper going on here for the person.
Right. And it has to really cause significant impairment in many areas of our lives. For example, in our occupation, our interpersonal life, if it's causing such severe distress, then there is something a little deeper going on. And again, the frequency, the intensity, and the duration are all important factors to keep in mind too. One of the common factors when it comes to panic disorder is a person needs to have 2 unexpected panic disorders without any trigger or anything happening over, again, a period of 3 to 6 months. Because sometimes, especially with COVID, for example, I saw an increase in anxiety. But again, a common theme there was the unknown. We didn't know what was happening, and it was uncertain. And sometimes our tolerance levels to discomfort, uncertainty play a huge role in anxiety.
Absolutely. And I think the important part for people to know the difference between like an anxiety attack versus a panic attack
Yes.
is that anxiety attacks, there's almost like a gradual buildup, and it's almost always surrounded by, you know what the situation is, you know what you're getting anxious about, and there's a buildup, and you know, and you're trying to move through it, and it can
Right.
feel, debilitating, but you can still understand what's kind of happening to you. Versus a panic attack, a
Right.
lot of times for people, it may feel like they're dying or they're having a heart attack. And it's almost like an out of body experience where there's a high level of almost terror,
Oh, yeah.
where you feel completely out of control and the onset is almost immediate.
Okay.
So I think that's a big differentiator for people who might be experiencing anxiety versus panic.
That's a very common question I've gotten asked recently, is the difference between anxiety attacks and panic attacks. And the way I also try to describe it is anxiety attacks, like you said, we know what's happening, the trigger is there. And it's not so much a physiological response compared to the panic attack, where you could have, your heart racing, dry mouth,
Mm-hmm.
palms, um, upset stomach, for example. And it completely comes out of nowhere. Like there's no trigger, nothing
Yeah.
in your present moment is making this happen. So to me, that indicates also deeper internalized stress and things that we're not dealing with. Perhaps we suppress them. Sometimes I've noticed people who tend to avoid a lot or have an avoidant attachment style can sometimes
Mm-hmm.
experience panic attacks because a lot of things aren't getting addressed. So when I treat panic attacks or panic disorder, I'm really getting to the underlying issues of what's stressing you out and then working on stress management techniques. And once we get that stress under control, and again, self-awareness there is key,
Yeah.
a gradual decrease or the frequency or the intensity decreases.
Yeah. And I can see there's going to be a lot more frustration and avoiding a lot of maybe social events because there isn't a clear trigger, there isn't a clear link to
Yeah.
why someone might be experiencing this, which could feel even scarier, right? Like we have no control
Right.
over this versus people who may have anxiety disorder or anxiety panic attacks is what is kind of triggering you, or the circumstances, the situation, and we're more likely to avoid them
Right.
or isolate. Like that's an active decision because we know there's like a cause and effect versus really not knowing what's happening.
And it's really kind of a probability issue too, because people are prone to that social anxiety, OCD, even ADHD. We have this interpretation or almost this confirmation bias, like, well, I don't want to go because I am not comfortable with the unknown, or I don't know what's going to happen.
Mm-hmm.
Feeding that thought process in the brain even more. So a little education for people is an overactive amygdala and cortex is what is feeding these thoughts. And so when we know that, we can say, okay, I'm interpreting this a certain type of way. If I feed into it, then the worry is going to be even more extreme. But if I change my interpretation a little bit, I can say, instead of I need to know what's going to happen, I can't tolerate the unknown, what we can maybe say is something like, I need this opportunity to learn how to tolerate uncomfortable situations. So again, you hear the difference. We're saying like, I need the opportunity to be able,
Mm-hmm.
because again, the probability that something may happen is relatively low. It could be high, but we still don't know for sure. And that's something that we really work with a lot, is trying to get people to open themselves up to the possibility that their initial confirmation biased thoughts may not be accurate. So therefore, because we don't want to hold people back or hold themselves back from these.
Mm-hmm. Absolutely. I love that you say that because it's really challenging our thoughts and being more realistic and having more of an open mind of all the scenarios that could happen, right? I think, and I've struggled with anxiety, especially social anxiety, a lot in my life, is that we imagine the worst case scenario in our mind,
Mhm.
and then we feel it in our body, and then we imagine what that's going to be like to move through that. And we're like, I don't want to feel that discomfort. I already felt what it's like in my body. I'm good.
Well,
Right? Versus being like, okay, that's a possibility. It could happen, right? It's not zero chance. It could happen. And is there something just as likely or more likely to happen that either nothing bad will happen or I'll actually have a good time or a positive experience.
Okay.
And what will that feel like in my body? To at least allow ourselves to see and understand different options.
Yeah.
And I think a big part is feeling it in our body, is like kind of like visualizing and grounding ourselves in those senses as well.
Absolutely. And it's learning how to trust yourself a little bit more instead of trusting
Mhm.
logical thoughts that have possibly prevented you from enjoying life or having certain experiences. So, one of the things I really try to normalize and validate for people is look for the most tiny baby step opportunities you possibly can. And then
Mhm.
from there, because sometimes people want to jump to, oh, I need to go to this huge concert, but I'm terrified of being around a ton of people. Okay, well, maybe just start by going to a coffee shop. Maybe just start by having somebody over your house. Gauge how you
Mhm.
build your tolerance, and again, change the way we approach anxiety rather than like trying to say, no, don't be anxious, because that just makes us more anxious.
Sure. It never works to say, don't feel this feeling. If it was that easy, we wouldn't be feeling it, right? If there was a
But
switch.
we'd be out of a job if I told people, okay, cool, they're all better, and it's just unreal. The brain is so powerful, and once we develop those thoughts and strengthen those thoughts in the brain, that's what's telling us is our reality.
Mhm.
When again, we're just strengthening unhelpful thought processes.
For sure. And I like how you said kind of exposing ourselves slowly to some of these things, right? So it's building that window of tolerance. So
Yes.
I think there's different levels between discomfort, a comfort zone, and like dangerous, right?
Right.
Like we don't want to put ourselves in dangerous situations that are super risky just for the sake of, pushing ourselves. That's not the point. And, sometimes we want to be in a level of comfort so that we can soothe our nervous system,
Right.
but we don't always want to stay in the comfort zone because then we don't necessarily grow, we isolate, or like you're saying, we prevent ourselves from experiencing more.
Right.
So it's really kind of playing and testing with the discomfort tolerance window of
Yes.
pushing it a little bit further and further and seeing, like, okay, this was really uncomfortable.
Mhm.
It wasn't a great feeling, but I'm not hurt. I'm still safe. I managed through it. Like, that's a really big deal that I even did this thing. Let me see if I can keep doing the same thing until it feels pretty normal and then extend that window some more.
Exactly. And I love that you brought that up because that's one of the main treatments with OCD is the exposure prevention therapy. So you expose yourself to a triggering stimuli and you rate on a scale how discomfort or comfortable.
Uh,
And so we can use those numbers as a tangible treatment plan to say, okay, this is where you were at when you exposed yourself to this stimuli. Let's do it again in a week and see where you are with the same exact stimuli. So
uh,
exposure, again, in theory, over time, should decrease the level of discomfort and increase your sense of self, increase your confidence, increase your ability to withstand being uncomfortable.